Welcome everyone to the 2024 PI Conference. My name is Carissa Marson. I am a volunteer with IDF and I will be your moderator for this session. Today, Dr. Elena Perez will be presenting The Future is Now, Preparing for Transition to Adult Care. The session will be about 45 minutes, and we'll be keeping to that time frame in order to keep the conference running on schedule and everything going smoothly. If time permits, we'll be asking some question, answer type things at the end of the presentation. A little disclaimer. So the information presented during this session is not medical advice, nor is it intended to be a substitute for medical advice, diagnosis, or treatment. Always seek the advice of your physician, or qualified health provider with questions concerning a medical condition. The Immune Deficiency Foundation education events offer a wide array of educational presentations, including presentations developed by healthcare and life management professionals, invited to serve as presenters. The views and opinions expressed by guest speakers do not necessarily reflect the views and opinions of IDF. All right, and I'm going to introduce Dr. Elena Perez, who graduated from the University of Florida College of Medicine with a combined MD, PhD degree in 1998. She completed her residency in pediatrics in 2001 and fellowship in allergy immunology in 2004 at the Children's Hospital of Philadelphia, where she stayed until 2008 as an assistant professor. Dr. Perez is board certified in pediatrics and allergy and immunology. And there's more awesome information about her in the bios of you guys' packet. So check that out and welcome.
Good morning. Thank you very much for inviting me here. It's an honor. And I don't know why I just got emotional from the get-go. But here to share some hopefully good information with you and hopefully to engage with the crowd as well and answer some questions if possible and get you guys to kind of talk to each other too, because sometimes we learn the most from our peers. As I was thinking about preparing this talk, I started kind of taking a very motherly approach. I have 3 girls who are in their teens and going through lots of transitions. So not just medical transitions, but also personal growth and just stages of life that we have to think about. And come to think of all of the parts of life, and I found this quote by George Stigler, who was actually an American economist, who said, "A transition period is a period between 2 transition periods." And I think he was talking about economics, but I was like, yeah, this is true. You know, your whole life is a transition from one stage to the next to the next. And going by my motherly approach, I was thinking of little ducklings and how little ducklings then have to learn how to fly and be on their own. So we travel from infancy to toddlerhood to childhood, which is a very parent-centered, parent-caregiver time of life, to adolescence when we're trying to give you your wings and trying to guide you in the right direction, and then to hopefully to adulthood when you become self-reliant and your care transitions from pediatric-centered to adult-centered. And that's not always very easy. But then I remembered I shouldn't be talking about ducklings, I should be talking about zebras. And so I had to get some baby zebra pictures in there just for, alliance with IDF. So just like little ducklings, little zebras grow up and become zebra adults and go through lots of transitions as well. So transition of care, there's lots of timing and issues that are related, and I just kind of threw these down here to get our juices flowing. Adolescence is a very vulnerable time in our lives. We're developing skills. We have high risk, high stakes decision making, peer pressure, so many things that are happening during this time. Even our brains are still under construction. So even though sometimes as teens we feel like we can conquer the world, we know better than our parents, really our brains are still learning how to become an adult, and so we have to kind of take a step back and think about that sometimes. Also, our access to a medical home might be a little challenging. Some people live in remote areas. Some people are not close to academic centers where they know about PI, and have to kind of struggle to find a good provider of care. You're also starting to age out of pediatric services. The field of allergy and immunology trains us to take care of pediatrics and adults, but in academic centers, often you'll be a pediatrician, you'll be seeing a pediatric specialist, but when you get to about 21 or 22, depending on the institution, they'll say, okay, now you have to go to the adult world. Private practice is a little bit different, where we can see kids all the way through adults, and I think it's one of the beauties of our specialty, but it's not easy to find an allergist who also does immunologist, or an immunologist who also does allergy. We also need to tend to chronic issues versus acute issues, and sometimes adult doctors and providers are not familiar with pediatric diseases and pediatric diagnoses of PI. They have not ever really gotten too much training about it, so we also have to make sure we educate our providers and make those alliances with specialists as well. Then our goal, right, is to become self-efficient and self-advocating for our health. And this is one of the official definitions of transition, which was taken from one of the presentations that is available on the IDF website. So a transition here is defined as a purposeful, planned movement of adolescent and young adults with a chronic medical condition from child-centered to adult-oriented healthcare systems. This is a multi-step process towards medical independence. And having a transition plan can really help prevent gaps in care, medication lapses, and even hospitalization. So you can envision that there's times where, as you're growing up, there's insurance issues, there's moving away to go to school issues, there's how do I get a job issue, all of those things, and how do you get your medical care, and relationships, even interfamily relationships. Parents want to take care of their kids usually and not let go, and kids are like, hey, I want to take care of myself now. Or sometimes it's the opposite. Maybe some kids are like, I want mom to do everything. So you have to kind of see where you are in that stage and kind of plan for it. And planning ahead gives us a little bit of security or insurance that things will go hopefully better. So these are some barriers for transition in peds versus adult care. So in pediatric care, it's very family-centered. The parent and the caregiver often makes the decisions for you in certain ways. The patient is a little more passive in that process, and it's growth and development focused. And oftentimes there's a multidisciplinary team that's involved in the care. In adult care, it becomes more patient-centered, and the patient has to make more decisions, and the patient has to be more active in their role and more advocating for themselves. There's limited time to focus on growth and development in adult-centered care, and there could be difficulties with multidisciplinary teams. I think one trend, at least in some of the bigger academic centers, is now to do transition teams, but that's not always available in the community. And there's also now some faculty members and staff members that are aligned to help make that transition, and even have, like, for example, in cardiology, there is now a specialty called adult congenital heart disease. So little babies who are born with heart disease, the adults have never seen these kind of conditions happen or have an adult who has it. So the same kind of thing can be said for primary immune deficiency. Adult medicine doctors are not as familiar with primary immune deficiencies, and as we take better care of you, you guys are doing better, you're growing up, you're becoming adults, and we need a lot of more education on the medical side as well. So the more informed you are, the better informed your caregivers can be as well. So there's some more challenges here to overcome. I just kind of listed them, but we can get into that if we have a discussion among the group. Fear of a new healthcare system, letting go of control on the parent side, logistical issues, how's insurance going to play out, inadequate preparation for the transition, social or financial instability, lack of data for growing up with a rare disorder, that's what I was mentioning before, communication gaps, medical records transfer, lack of guidance, lack of access, and acknowledging that PID is rare and different, and so finding a specialist who can care for you can sometimes be difficult. And then there's no clear consensus guidelines on how to take care of kids who are growing up, and each PI disorder can be unique in and of itself. So we don't treat everybody with CVID the same way we treat somebody with CGD, the same way we treat somebody with hyper-IgM. There's so many, you guys have such a diversity in your presentation that there's not a clear consensus guideline for each individual PI on how to grow up and become and get the right care that you need as an adult. So we want to empower you to manage your own health, and we want to ensure that there's an organized process in place. And we can plan that transition anywhere between 18 and 22 years old, but it can very much vary person to person and situation to situation. But the discussions can even start as early as 12 to 14 years old or even earlier. So you kind of want to make a roadmap. How's that future going to look for me? You want to set appropriate goals. They say Rome wasn't built in a day. You can't tackle all the problems all at once, but if you make a guided plan and you kind of break it down into the smaller pieces, then you'll start to see that things start to fall in place. Shared decision making is a new kind of catchphrase in medicine. It used to be that the doctor would write you a prescription and say, okay, take this, and come back and see me later. Okay, now take this. We would make the decisions for the particular thing that you were coming to see us for. Now there's this concept of shared decision making where we want to not just prescribe something and send you on your way, but we want you to be involved in knowing what the options are, answering your questions, making sure that you are aware of the different paths that you can take for a particular issue, and then involve you in that decision making. And so we want you to be a participant in your care, basically. And we want to make sure that you get the information that you need to make those decisions. So simple things to start with is getting to know what your medications are, getting to know how to schedule an appointment, asking questions at your visit, making sure that you maybe come with a list of questions or concerns, because sometimes office visits can be very hurried and not give you that opportunity. But if you come with a list, then you're going to remember what you wanted to ask about. And then, use resources available through the IDF. There's also another service called gottransition.org, and these are readiness quizzes that kind of present to you different questions about your journey and where you are, and kind of help you assess, okay, I haven't done this yet, but I have done that, so kind of gives you an idea of how to go through that transition. So there are age-appropriate checklists. Around 12 to 14 years old, we want you to start learning the name of your medication, knowing who your emergency contacts are, knowing your allergies, getting to know more about what that medical condition is. At 15 to 17, you want to discuss more about the condition and understand more about the medications, why you have to take a certain medication, and start engaging more with the physicians. And 18 plus, you want to kind of get a handle on your medical summary, start to learn more about insurance coverage as you're moving out in the world. Can you still be on your parents' plan? Do you need to find your own plan? What are the options, and how can you best be covered? You need to learn how to check in for yourself at your own appointments and sign consents. Now you're 18, all of a sudden you're considered an adult in the eyes of many, and so legally speaking, the decision making is kind of being transferred to you, and you may or may not be ready to make those kinds of decisions. So practice at your visits. Try to start engaging, be a participant in those doctor visits, and look at those readiness questionnaires about medicine management, appointment tracking your health issues, and communication, reviewing your goals. And they talk about preparing a transfer summary with the physician. Sometimes when we're seeing in a busy clinic, a patient comes to us, and you might already be familiar with this, we get a stack this big of binders and binders and binders of labs and history. And that's fine, but if you can organize it, if you can get familiar with it, understand when you had the last CT scan and what your laboratory abnormalities were, that facilitates the discussion, and that helps other doctors and other caregivers track back and understand the history better. There's also condition fact sheets that you might already be familiar with, but for any particular immune diagnosis, the NIH and other organizations have like a one-page summary of what's involved in a particular diagnosis. And so those are very helpful, I think, to start to learn a little bit more and understand as much as we do about the condition that you have. So this is just an example of the IDF questionnaires and also an immunocompromised card that the IDF has on their website. The questionnaires are age appropriate and kind of just go down the list. I don't think you can maybe read that because I can't. And there's categories like general information. I can tell someone the name of my primary immune deficiency. I can share my medical history with a healthcare provider, yes or no, or I'm almost there. Medication and treatments, can I list them? Can I take all the medication as prescriptions and notify a parent or guardian when my supply is low? All these practical questions and all these different categories, and you can go through the checklist as you're ready and then go back to it and say, wait, I haven't learned how to do this yet. The I am immunocompromised card is on the right and basically has your name, date of birth, what language you speak, and what's the name of your immune deficiency and who your emergency contacts are. So you can cut this out, fold it up, and keep it in your wallet in case there's an emergency or in case you need to communicate about your immune deficiency with your caregivers. There's also an IDF guide for young adults available on the website that you guys can take some time and read and give us feedback to. I think we're always trying to improve. So there's important elements in your medical summary. Obviously, your diagnosis and when you were diagnosed. Who were your previous doctors? So I'm not sure if you realize it, but immunologists are somewhat of zebras as well. We're not so common in the community and we're not so common around the world. It's a growing but small community of physicians who really, really dig immunology and try to understand how best to help people with PI. And so knowing the names of the previous doctors helps us make connections and get more records and more insights from the doctors who previously took care of you. Making sure you have a pretty thorough list of past and current therapies. Are you taking antibiotic prophylaxis? Which immunoglobulin products are you taking, if any? And if you have taken others that had side effects, let's try to avoid those in the future. And are you on a biologic therapy? Are you on immunosuppressive medications? If you had a transplant, what were the details of that transplant? What complications, if any, happened? You want to have a history of your hospitalizations, your surgeries. All of these things help inform your care team of the big picture of you and how best to take care of you. A management plan. So this is really important. Sometimes as you're transitioning from pediatric care to adult care, that management plan can kind of fall apart. And so if you already have, my immunologist said, this is what we should do. We should stay on our gamma globulin. We should get our labs checked every 3 to 6 months. We should continue or not on antibiotic prophylaxis. If this happens, I'm supposed to call you to let you know that I'm sick if I go to the emergency room, et cetera, et cetera. So having a little bit of a knowledge of what your pediatrician immunologist would want to happen or how they would handle certain things moving forward helps kind of hand off the baton to the adult providers. And then kind of knowing what the next steps are in your care. If there's genetic results available, then we sometimes get into family planning, and those things are very important to know and to share with your adult doctors. These are just some references to the condition fact sheets I was mentioning. So the IDF has a patient and family handbook that you can download specific chapters related to specific conditions. I believe it's going to be revamped in 2025, but that's available on the immune deficiency website, IDF website, primaryimmune.org. There's also at the NIAID website, they have those one-pager descriptions of different types of PI. And then also the Organization for Rare Diseases also has a list of rare diseases available as a database and also downloadable and easy enough to read to kind of get acquainted with what the diagnosis is. And then as you're out there in the new world trying to figure things out, and if you move to a different location, the IDF has a clinician finder, so it helps you find a a doctor that takes care of immune deficiency. If you go into this website, it may help you. But also, like I mentioned, our Zebra network of immunologists probably know an immunologist somewhere, wherever you are in the country, that can try to help facilitate a connection for you. And then I just want to kind of end here on the note with hoping for the future and aiming for success, and we're here to help. And at this point, I would open up the discussion for any questions and kind of get some feedback from you guys, and maybe you guys can help each other as well. Thanks.
Thank you, Dr. Perez. Please give a round of applause for Dr. Perez and that wonderful and an informative presentation. I just quickly, before we do our Q&A, I just want to share some resources for IDF. If you have a question, get help from Ask IDF. Are you looking for peer support? Are there any young adults here who are looking to connect to other young adults? Please come to our website and look for the Get Connected YA group. It's for young adults 18 to 25. And also look for information for our upcoming 2025 Escape Weekend. That will be for preteens and teens as well. Thank you again, Dr. Perez, for that wonderful presentation. And thank you, Carissa, for opening up this first session. And we will open the room up for any questions that you have for Dr. Perez. Carissa is also a member of the community, and so she has had to transition herself from being a teen to an adult, managing her own medical experience. So please feel free to ask questions of Carissa as well. You just raise your hand, and I will come to you. And just give me one moment. I need to make sure I have this. All right, anyone have any questions? Raise your hands, and I'll come to you. I have a question. Oh, anyone? Let me see. Oh, David does. Okay, David. Please make sure you speak into the mic. This is being recorded.
Hey, everyone. My name's Dave. I'm from Immunity Canada. Kind of like these guys, but much smaller. And I was just wondering, with the families in the room, with the resources shared, is there anything in particular you found really useful? Because we're trying to put together a resource for our families up in Canada.
That's a great question. It's just protocol. We ourselves here at IDF are always wondering how we can better serve families as well. So I'd love to hear the answer to that question. I'm going to start here because I saw you first, Allison.
I think the thing that I found most helpful on the IDF website was the guide for school-aged children. We printed that out every year and gave that to the school at the beginning of each school year. I provided it to his teachers so that before the school year, they had an idea of who would be in their class and what special needs that they had. It was provided to administration so they could provide a medical plan. And everyone then was on the same page for, the fact that he might have more absences and may be absent for longer. It facilitated the teachers being more willing, especially in the high school years, to provide homework to be done at home and things like that. So that was the biggest resource for us.
Thank you, Allison. I think Jason. No? Okay, my bad. Rachel does. Also, we also at IDF have a young adult guidebook that was revised in 2022. So check that out.
Okay, so I'll be going to college soon, and I live in Louisiana, and you probably have only heard of New Orleans, and if you live in Louisiana and you have Medicaid or any kind of government health care, all you hear of is New Orleans as well. And I live in northern Louisiana, so that's a 5-hour drive for the major hospitals, unless I go to like an LSU Health Center, which is our big university, which is a headache, and doctor's appointments take forever. So I really enjoy, as far as the website goes, the clinician finder, because I will be moving to the more middle region of Louisiana, and I'd really like for college to be able to find an immunologist quicker and easier that way. And also some of my connections I've made here, I've talked to people where they're like, hey, I know Maryland sounds really far away, but these doctors will fly you out to get you your medical needs and your appointments done. Like, we are willing to network with you and talk to you to try to get where you need to be. So.
Thank you, Rachel. Rachel brings up a really good point as well. Rachel is part of our youth advisory committee, and she will be part of a presentation panel to discuss thriving in academics. And we will touch upon the idea of your children and yourselves moving to a different state, and what does that look like in terms of getting your medication and all of the facets that go along with that. So look on your schedule to make sure that you are scheduled to be in that session. Okay, I'm going to go way over here to my new friend. I know his name already. It's Tanner.
Hello, I'm Tanner. I'm 24 years old, and I want to say a couple things before I ask the question. They asked a question earlier during the presentation. They were like, "Can you give us one word that you would try to?" Sorry, I'm losing my train of thought. I just want to say that I try to be as normal as possible. You know, for a long time, that as a young adult, I definitely didn't tell anyone about my condition, just because I didn't want to be judged. And I feel like everybody in the room can pretty much agree with that, because, you know, just growing up and going through school, you know, people a lot of times will base their opinion on, you know, the first time meeting you, and when you tell somebody you have a disease, the first thing is it contagious? Oh my God, get away from me. You know what I mean? So I definitely didn't tell anybody, but, you know, as I get older, and I have started to tell more and more people, you know, I feel like people are definitely a lot more understanding, and that's a big thing for me too. And growing up, my immunologist was Dr. Gary Kleiner, and he told my mom, you know, he's just like any other kid, you know, let him do what he wants to do, and if he gets sick, we will treat him. And that's the way I've kind of lived my life. You know, I've played football, baseball, you know, I travel for work, you know, even during COVID, I was traveling for work quite a bit. So that was a big thing too, is, you know, like, you only live once, so I would definitely, you know, get out there and explore life. That's a big thing, you know, because especially with, you know, our disease, you know, we wake up with something new every day, and that's definitely a struggle. But my question really is, I work quite a bit, so it's definitely difficult, you know, just because if we walk in the street, you know, everybody sees us, and, you know, we look totally normal. You know, it's a really invisible disease for a lot of people. So just trying to explain to coworkers and, you know, bosses that, you know, I think exhaustion is really the biggest thing that I've dealt with, and usually I push through it. Just, you know, playing sports, even after school, I would definitely push through it. But at work, it gets to points where, you know, because what I do, there's a lot of critical thinking. I'm a nuclear technician. I travel quite a bit. Right now, I'm at the nuclear power plant in Brunswick, North Carolina. We are doing a dry cast fuel where we're pulling the spent fuel out of the nuclear reactors, and we're putting it in dry cast storage right now. And it's a big thing, so you want to be on the top of your game all the time. So I think just trying to explain to your bosses that, you know, I might need to miss a day, not because I'm sick, just because I'm extremely exhausted. So.
This is a great question for our upcoming session, which will be in this room in just a little while, Zebra's Guide to Job Hunting, because they're going to have a discussion about when and how to discuss with your employer about your condition, and also the accommodations that need to be. So that's a great question. Table it for our next session. If anyone has a medical related question, let me know.
This isn't really a question, it's more back to like what you were saying, to help out your families. I'm already in college, I'm going into my second year. I'm a major in cybersecurity, so you would think that would be an online major. No, it is not. But basically, to help your families navigate the hardship of going to college, especially with immune deficiencies. Every different immune deficiency affects everybody differently. But mine is explaining to professors. It's kind of like explaining to a boss, but professors are like, oh, well, you were in your 3 p.m. class. Why weren't you in your 8 a.m. class? So providing resources for kids who are in college or even like their senior year of high school, just getting ready to transition from high school where if you miss a day, you miss a day. College, if you miss a class, it can like hurt you like it can hurt you a lot. By missing that one class, you could miss that whole unit. So definitely more providing like resources to families with college.
Thank you, Rihanna. I appreciate that. Tanner did bring up a good point, though. And in terms of medically, what is the best way or summary of how to explain to someone the conditions of PI? Yes, Dr. Perez.
Okay.
Are those not on? I can help you with that. Let me come to you. Here we go.
So explaining a PI to a layperson who doesn't necessarily even know what the immune system is or does could be very challenging. From a doctor perspective, I've had that difficulty in explaining someone their new diagnosis. And so the immune system is kind of invisible. It's your skin, it's your mucus, it's your white blood cells, it's the chemicals that your white blood cells secrete, and no one really sees it. And so I try, depending on what the immune system deficiency is, I kind of start by telling them, you know, I don't fight off infections the way that I should. And I try, depending on how interested the patient or the person is to learn about it, I try to break it down into, you know what, I don't make as many antibodies as I should, or you know what, I'm susceptible to certain types of bacteria that other people don't get, so there may be periods of time when I may be sicker. But it is a very challenging concept because it's not like you have asthma and you can say, you know, I wheeze when I'm around dogs or cats. It's deeper than that. It's very much more complex depending on the condition that you have. So I try to break it down into really the purpose of your immune system is to protect you from infection, and your immune system is impaired in some certain ways that makes you more susceptible to infection, and along with it come sometimes other conditions like autoimmune diseases and different struggles than the average person who has an intact immune system. But it can be very difficult. Sometimes I use diagrams. Sometimes I try to give examples, but it's almost like trying to describe a really beautiful rose to a person who's blind. Like, how do you do that? It's very, very, very difficult in some scenarios. So I also would try to engage with them and ask them if they have questions about what you go through every day and what your treatments look like. Because it's a very invisible kind of thing, I think. So it is a challenge. I hope I helped a little bit with that.
Thank you. I think we have time for one more question, and I'm going to come to Elena.
One of my biggest concerns for when I switch over to like my adult care is making sure that my new specialists and doctors understand like all of my medical history and my diagnosis with immune deficiency. So how can I make sure that these new doctors fully understand like everything and how it interacts with each other and like are able to understand it the way my pediatric specialists have, because they've like helped me throughout as I go through this stuff, and the new like adult ones, they wouldn't see me like as I get it. So like, how do I make sure that they understand all my diagnoses?
So I think, does this mic work? No, not anymore.
This one.
Okay.
I'll run it to you.
Okay. So I think that's a very good question. Just to kind of give you some familiarity with the profession of being an immunologist. Most immunologists, I would say, started out as pediatric immunologists, but not all. There are some adult specialized immunologists, and there are starting to be more and more of those around. I don't know that anyone's going to understand you to the T of everything that you went through in the pediatric world, someone who, from the diagnosis to all the struggles that you might have had until you got to adulthood. But I think that having a bridge of some sort, having documentation of your history helps. And I think partnering with an immunologist if you can. So you may have other different needs as an adult patient, other body systems that could be involved, cardiology, pulmonology, hematology, gastroenterology, and all of those subspecialists as adult subspecialists might not be in tune with immune deficiencies. And so having kind of a quarterback or having an immune deficiency expert be helpful in that transition, I think is super, super, super important. And even if you go to an allergist immunologist who doesn't completely dive into all of everything immunology, they should have some knowledge of immune deficiency and be able to guide you like, okay, this lab is looking funky, let's go see the hematologist or the GI doctor about this particular thing. So I think having transition from immunologist to immunologist, if that is possible, and hopefully it is for everyone, is key, because the other subspecialists or even the generalists might not have that knowledge of immune deficiency. So try to find a quarterback.
I like that analogy. I have a question for you all, for the parents in the room. What are the barriers to getting your children engaged in a conversation about transitioning to taking on their own medical care? What are some barriers? Because you're so close, thank you.
I can say one of the big barriers is when he turned 12, 13, you don't have access to their labs. We've really struggled with that, even though it's forced more learning on his part. But it can be a very large barrier, too.
To not have access to labs. Okay. Do you have any expertise or anything to say on that point?
Depending where you get your labs done, there's sometimes portals that you can access, like Quest and LabCorp and those kind of things. And it does, there is like a firewall. Once you're 18, the parent doesn't have that access anymore. There might be ways, depending on the medium that you're using to try to get to labs, where he can put you as, having access. So all those forms that you sign when you first go to a doctor's office or when you first become a patient, you can designate someone to share those records with, and you can ask your doctor, please, when there's a report to be given or a lab to be given, just please also CC so-and-so. As long as the child or the adolescent or the young adult gives permission, then it should hopefully be pretty seamless. But it's definitely a challenge for parents to get adult kids labs and other things. So you have to make sure you sign all the releases.
Definitely. Well, our time has come to an end. I want to thank Dr. Perez again for your time and your expertise. Please give her a round of applause. I also want to thank all of you for participating today in this session. Thank you for being here. Thank you for participating. And if you have any further questions or need any more resources, please come to Ask IDF. My name is Kat Sieber, and you are more than welcome to send me an email, ksieber@primaryimmune.org. I look forward to seeing all of you at our other later sessions underneath the escape track. I think there's about a 15-minute break between sessions, so utilize them well. All right, thank you.